Have you ever been told, good news, everything looks normal, and yet you still didn't feel normal? If so, you're definitely not alone. I see people all the time who have had imaging, lab work, or other testing done, and yet they've been told nothing major has shown up, and that they're still dealing with the same headaches, the same neck pain, the same dizziness, the same brain fog, the same fatigue, and something just does not feel right. And that can be incredibly frustrating. Now, I want to be clear, normal imaging can absolutely be helpful. It can rule out certain issues like cancer, infections, fractures, right? Rule out certain serious structural problems, and that matters. However, it does not always show us where the functional issues are, and it doesn't show us what is optimal. What many people don't realize is that normal does not always mean optimal, right? It's normal to get headaches. It's not optimal to get headaches. So a test may be normal from a pathological standpoint, and while you still have a very real functional problem happening in the body. And that can include altered biomechanics, chronic compensation patterns, nervous system stress, muscular imbalance, joint irritation, or subtle dysfunction in the way that your body is functioning and adapting to old injuries, repetitive stress, poor posture, or trauma. In other words, just because something dangerous didn't show up on a scan, it doesn't mean automatically there's no explanation for why you feel the way you feel. This is especially important when we look at the upper neck, like this, and the cranial-cervical junction, the area where your head meets your neck. It has a huge influence on the mechanics of your posture, the nervous system function, and when it's not functioning well, people may seem to experience things that don't always get explained clearly by one standard test alone. And that's part of why a lot of people are bouncing around from one thing to another, trying different medications, trying different stretches, different massages, different physical therapy, different drugs, different supplements, and they still feel stuck. And they start to wonder, is it all in their head? Or worse, the doctor starts to wonder if it's in your head. And that's just not fair. Because usually it's not. It's in your neck. And usually they just haven't had the right kind of evaluation yet, or you haven't had the right kind of evaluation yet. And in our office, we look at the whole picture, your history, your injuries, your symptoms, your examination findings, and then clinically appropriate, we do advanced imaging and structural analysis to help understand what's actually driving the problem. A lot of times, if we're taking this kind of imaging, we know you've got a cranial-cervical junction issue or an upper cervical misalignment. So the goal is not to guess. If you've got this problem, we need to be very precise, we need to be very specific. And that's what we specialize in this office. So if you've been told everything looks normal and you still know something isn't just quite right, it doesn't automatically mean nothing is there. You just haven't looked in the right places. And it may simply mean that the issues haven't been evaluated from the right perspective yet. So I'm Dr. Norris Golberg with Koru Chiropractic here in Louisville, Colorado. And if that sounds like your story, our office may be a good place to start.